I'm Susan Wolf. I'm a fertility doctor at University Reproductive Associates. Endometriosis is a condition where the tissue that normally is lining the uterus for some reason is implanted outside the uterus. And there are a lot of theories as to why it forms, and it can cause different problems for different people. Some women experience extreme pelvic pain. It can cause some scarring, and that can cause problems with infertility. It can cause problems with infertility even without any scarring. Premature menopause is menopause that happens before a certain age. And the average age of menopause is 51 and a half. What menopause is that the ovaries have run out of eggs or run out of functional eggs, and the ovaries aren't making the hormone estrogen any longer. You have the greatest number of eggs, which is about 7 billion before you're born, when your mother is about 7 months pregnant with you. And by the time you're born, you've already lost a lot of the eggs that you started with. During a woman's lifetime, she usually has between 400 and 500 ovulations. So with the hundreds of thousands of eggs that you have at the time that you start your reproductive life, you really only use a very small amount of them. In some women, unfortunately, this diminishment in the number of eggs happens more rapidly, and they go through premature menopause. In those women, if they're wanting to get pregnant, we have treatments that work very well. For women who are in premature menopause, we're happy that we do have very successful treatments to offer them. The main treatment is egg donation. Although that may not be what you had in mind when you were trying to get pregnant, the success rates with egg donation are really our best success rates in any of the treatments that we do. About 60% of the women who will do egg donation will get pregnant. Often when a patient comes, after we take a history and I get an idea of what's going to be involved, part of what we have to determine is what is acceptable for the patient. And sometimes patients have certain things that they'll do and certain things that they won't, that aren't acceptable to them. When we have a lot of things to offer patients and a lot of different treatments. And part of what determines whether you're going to be successful is how far you're willing to go. Nobody wants to have to come to us to get pregnant. But if you're willing to stick with it, we can help you go home with a baby.